We are joined now by Dr. Ali Hassoun, infectious disease specialist from Huntsville Hospital, to get his insight on the current coronavirus situation in our region.
All right, Dr. Hassoun, good to see you again. Thanks for joining us tonight.
Thank you for having me.
And we just heard WAAY 31's Max Cohan talk more about positive cases in Albertville City Schools. We also learned about more cases at Huntsville City Schools. In your opinion, is the risk of even just one case too high for students to be back in the classroom?
Yeah, I think it really considered significant because one case at the moment can transmit to other four because we still continue to have widespread infection. And that's definitely from 4 can expand to another 16, and that can expand more and more. So it is definitely worrisome. And you know, one important thing about this, you could diagnose one, but I'm wondering when they quarantine these students who get exposed, are they really testing everybody or just put them in quarantine? Are they tracking other things? I'll be interested more and get more information of what they're doing with those exposures.
Aren't they supposed to be doing that?
They should, absolutely. So, you know, those who's infected and people sitting around them, you're going to need to trace and track them as much as you can because you want to minimize infections by containing that episode of exposure. By tracing and tracking, you can do that. And if you don't do that, you're really not going to be able to know what's going on.
Dr. Hassoun, we know Huntsville City Schools are notifying the people who were in contact with the positive individuals. They're asking them to quarantine, and they're also deep cleaning all the buildings. Are these precautions really enough to keep other students and staff members safe?
What I would say, these precautions are helpful. It's very important to do it immediately to inform those who got exposed. But I think at the same time, probably we need to do more testing and tracing as well. So cleaning the environment, doing the physical distancing, if you get exposed, staying at home in quarantine, these are essential and important. But I think on the top of that, we really need to do more testing to know who's positive, who's not.
Let's talk a little bit about college campuses now. We heard from officials at the University of Alabama that positivity rate is dropping. There are no students hospitalized or reporting significant symptoms. We saw an initial spike, of course, after the first move in there, but so far so good after Labor Day. Are they doing something right, or is it just the demographic that's keeping those numbers down?
I think part of it could be demographic, but I think at the same time, you know, University of Alabama, specifically UAB more, they started using the app. They were more into testing a student and tracing those exposed. Also, they pushed for any of the student where they go out and you know, get exposed in bars and restaurants, more fines associated and restriction. So I think now they have some good element of trying to control it. Of course, these are good signs at the moment because our numbers is going down. But as October and November coming up, I think there's going to be increased confusion about is it COVID, is it other viral infection? And that'll be interesting to see what's going to happen.
Mm-hmm. And speaking of that, while the coronavirus continues to be a big concern now in schools, the flu is another issue that we deal with every year. Local health and city leaders have expressed their concern about the flu season and the coronavirus pandemic happening simultaneously. We know both can be deadly viruses. So what other factors make dealing with both the coronavirus and the flu at the same time so dangerous?
Oh, the main factor gets into it is one, in the community, it get to be where somebody had a flu, another one had COVID. Could there possibility of what we call co-infection? Both viruses happen at the same time in one person. You know, at the moment, the reports that about the COVID shown lower percentage of co-infection between flu and COVID. But we really didn't have a widespread flu infection. So what's going to be interesting, if somebody get infected with both viruses, are we going to see more severe diseases? On the other hand, if we see flu and COVID, the other concern is the hospital, as well as physicians and healthcare professionals, for them it's going to be very confusing because the symptoms and signs almost similar. And when you get that to be the case, then there's going to be delay in admission, ICU is going to be getting full, and at the same time, there's going to be isolation more and quarantine more, and it get to be more and more confusing for everyone.
When it comes to the symptoms, is there something about the timing of when someone shows them that could help doctors determine which virus the patient has?
Yeah, I wish that, Dan, it's not going to be that easy because, you know, each individual, depending on their ability to fight infection, you know, what's their exposure, how much is their exposure, for how long, all these are factors will make a difference in when is the symptoms and what's going to be like. So it'll be very tough to differentiate.
Yeah.
Dr. Hassoun, with everything going on now, explain to the community why you really stress the importance of getting that flu shot this year.
And that's very, very important to do it, and I would recommend to do it sooner than later because we've seen flu cases over the years to start sometime in October or late October, November. We've seen it sometime it get delayed, but if we have this season where it can start early, you better get the flu shot earlier so you'll be at least immune to the flu, or even if you had the flu virus, you'll be able to fight it off and you'll have minimal or mild symptoms. And by doing that, what's going to happen, you'll be able to reduce transmission to others, the flu virus. In addition, by doing that, what's going to do, you really minimize the flu infections, so COVID hopefully will be more taken care of and treated easily. And compare, you get mixed between the two, you don't know how to treat it to start with, waiting 2 to 3 days, it's just going to be more and more disastrous for us. So the flu shot is very, very important this year.
We have a lot more to discuss with Dr. Ali Hassoun tonight, including a timeline for the coronavirus vaccine and the recent case numbers here in North Alabama.
Stay with us. WAAY 31 News at 6. I'll be right back.